Good morning, viewers. You're welcome to today's edition of Lawyers Alert Thursday Facebook Live series. My name is Goziem Onugha, and I'm your host for today on the topic Ebola and COVID-19 in lessons. I think I should first of all apologize for the lateness. We are religious with the time, 11 o'clock a.m., 11 a.m. But for situations beyond our control, we are unable to start at the appropriate time. Bear with us. Now, Ebola and COVID-19, any lessons? The topic is Ebola. We all know what Ebola is, and we all know what COVID-19 is. However, if we do not know, Ebola is a virus that broke out in the year 2014. The first index case of Ebola was on 6th day of August 2014. And that index case was a foreigner, a Liberian American called Patrick Sawyer, who flew into Nigeria for a business. However, Ebola, the virus, broke out first in Guinea. From Guinea, it spread through the other parts of West Africa. Now, there is something particular about Ebola. It was brought into Nigeria by a foreigner. It didn't start in Nigeria. Looking at COVID-19, the same thing happened. The first index case of COVID-19 in Nigeria was a foreigner, an Italian man who flew from there to here on a business. And the first index case was found out on the 27th day of February 2020. However, COVID-19 started or broke out, first of all, in Wuhan, China. That is where it originated from. These viruses have never started from Nigeria. We are talking about Nigeria because, as the topic goes, we are particular about Nigeria in this episode. Now, this virus, COVID-19, is from a family of viruses called coronavirus. It is caused by a severe acute respiratory syndrome, which also falls under the family of viruses called COVID-19. Now, we know what we have battled. We battled with Ebola, and we know what we are battling with COVID-19. In the case of Ebola that broke out in 2014, a lot of people did not die. About 20 died, 6 persons died, 13 died, 17, 20 persons died. Not more than 50 persons on the whole died of Ebola at the time it was prevalent in Nigeria. Now, COVID-19 is a totally different case. A lot of persons, hundreds have died, and thousands have been diagnosed with COVID-19 in Nigeria. Now, I think we should move on to the any lessons. I think that's the most interesting part of it. Now, is there any lessons? What lessons do you think I should have learned from this? What lessons do you think the federal government and of Nigeria should have learned from this? What lessons have you learned from this? I can say that I have learned 3 lessons that I believe every other person in Nigeria should have learned at this time. 1. Technology. You know, a lot of things have gone sour since COVID-19 broke out in Nigeria. Businesses have died, businesses have gone down. A lot, the government is not running as well. Welfare is at the ground level. Why? Because even in terms of court proceedings, trials in courts, things are not going well. We are barely trying to adapt with technology because it has never been an institution for us in Nigeria. That is the first lesson I believe we all should have learned by now. Going forward, we implore the federal government of Nigeria and the rest of us, because we actually make up the government, to learn from this and institutionalize technology as a way of making things happen Because technology actually is one of the fastest means of executing deals, of carrying out functions, of making things work actually. The second, and I'm giving these lessons not in in a list of priority. No, I'm not prioritizing these lessons. I'm just making mention of them. Not and they do not fall in order of priority. The second lesson I believe that I have learned, and I believe that you have also learned, is hygiene. There is something particular about COVID 19 and Ebola. At the time Ebola broke out, persons that contracted Ebola and the persons that died from it were said to have not maintained good hygiene etiquette. Now, COVID 19 is the same. The federal government, organizations, non governmental, are imploring everyone to maintain good hygiene standards so that the spread will reduce or will stop, and we would no longer have new cases of coronavirus. Before now, public places did not have any hygiene, um, any hygiene standards institutionalized. Right now, because of COVID 19, there are hand sanitizers in public places, even in private places. There are people wear face masks to protect themselves from other persons. People have buckets and bowls and soaps and everything at their gates for outsiders or visitors to make use of before they access buildings or property. That is what I believe we all should have learned. Now, the third lesson I believe we all should have learned is healthcare. In terms of healthcare, I think it goes both ways. Healthcare, one, that Nigeria as it is, unfortunately, does not have good and sufficient amount of health facilities in it. In her, better put, there are no good hospitals, there are not even enough hospitals. So most of us, I know that we believe in something, even those of us who are not Christians, we believe in something. So a lot of persons are of the opinion that we are living and alive, and most persons have that have been dictated of diagnosed of having coronavirus are still alive, and most are recovering. Most persons think that this is happening because of our thick skin. However, it hasn't been proven. So we say thank you, God, for making us alive. Not because we attribute our health to our healthcare systems. Our healthcare systems are poor. Have we learned the lesson from this COVID 19 pandemic that we should have basic healthcare infrastructures? Have we learned? Then another part of it is that when foreigners are coming into Nigeria going forward, even when COVID 19 becomes an epidemic and leaves the pandemic space, we do proper health checks of these people. We take full responsibility of our nation and the healthcare and well being of the citizens. We should ease the way we feel we act nonchalantly about the health of our citizens by allowing foreigners come into Nigeria without proper checks. These are the major three lessons that I believe everybody would have learned. I don't know what you have learned that is different from what I have said. And I would love it for you to drop your comments below at the comment section so that I can learn from you. And let it be so that I can also make inputs and we can interact. I can respond if need be. Thank you so much for being with me on this episode of Lawyers Alert Thursday Facebook series. I hope you join us next week as we bring another interesting topic to your way. Have a nice